Infant Nutrition and Feeding. I am Dr. Pathum Dissanayake, Senior Lecturer from Department of Pediatrics, Faculty of Medicine, University of Peradeniya. Today I have prepared a lecture on the topic of infant nutrition and feeding. This lecture is targeting the undergraduates, first contact doctors and family practitioners. As first contact doctors, it is important to have an adequate knowledge on infant nutrition and feeding when dealing with the child's growth and also in detecting any nutritional problem related to an infant. This lecture will be delivered in two parts. The first part will focus on infant feeding and nutrition during the first 6 months, and the second part will be telecasted later, which will focus on complementary feeding, the second half of infancy and beyond. So what are we going to learn under infant nutrition and feeding? As a family practitioner or family physician, infant feeding, problems associated with infant feeding, the technique of infant feeding and nutrition in pediatrics plays a huge role, because if we don't understand the proper feeding techniques, feeding methods, what to feed, what not to feed, this will end up in pediatric malnourishment, which can have devastating effects even as adults. So what are the topics we are going to cover under this important lecture? These are the topics which we are going to cover. So wait, okay, so breastfeeding. Okay, breastfeeding, its advantages, disadvantages and problems related to breastfeeding will be covered in this topic. Then formula feeds, when and how to use formula feeds. Complementary feeding, when we can introduce semi-solid and solids to a child. Feeding in special circumstances, and finally nutrition disorders. So in part 1 I will be covering breastfeeding and formula feeds. In part 2 the complementary feeding, feeding in special circumstances and nutritional disorders will be covered. So we'll go to breastfeeding. Infant feeding, it's a period of unique feeding pattern where rapid growth is experienced. So during infant feeding, that is feeding during the first year, the weight will be increased by 300%. A 3 kilo baby will become 9 kilos at the end of 1 year, and the length increased by 50%, and brain weight doubles. So if your infant feeding or feeding during the first year does not happen properly, it can have damaging effects on your weight, length, and not only on the growth of the body but growth of the brain as well. So a child's intellectual development also can be affected if the infant feeding does not happen properly. And for 6 months breastfeeding is the best food which is available for babies. So that's why WHO has recommended exclusive breastfeeding during the first 6 months. And breastfeeding should be initiated within 30 minutes of birth. So once a baby is born, if the baby is otherwise healthy, you have to take every measures to initiate breastfeeding within the first 30 minutes. And as I have said before, WHO has recommended exclusive breastfeeding till 6 months of age. Exclusive breastfeeding means unless you are giving some important medication, nothing else should be given during the first 6 months, not even water. During the second 6 months or 6 to 12 months, you can continue with supplementary foods. But on-demand feeding is recommended during this whole period. On-demand feeding means we don't regularly feed a child according to a timetable of hours, but the child will be fed on demand by the baby itself. So the baby will decide when the baby is hungry and when to eat and when not to eat. This breastfeeding can be continued till 2 years or more, only if it doesn't disturb the routine meals or growth. If breastfeeding disturbs the routine meals of a child or growth, then breastfeeding has to be limited. But this comes after 1 year, not before 1 year. So before 1 year, breastfeeding plays an important role in infant feeding. Now, we go to the second part, breastfeeding technique. Now, breastfeeding to happen properly, you need to have a proper attachment and a proper positioning. Just because there is a breast and a baby, breastfeeding will not occur. It's not like putting petrol to a car. There should be a technique where proper attachment and proper positioning is needed. So what is proper attachment? The baby's mouth should be O-shaped when he start to feed. That means his mouth should be fully open. If the mouth is not fully open or partially open, what will happen is the baby will suck only the nipple of the breast, and nipple of the breast does not have enough milk. The nipple and areola both should be inside the baby's mouth. Areola is the area which contains milk ducts which the baby can press and get the milk. If the baby does not have an O-shaped mouth, or if the baby does not open the mouth fully and suck only the nipple, it will result in nipple cracking and nipple damage. When the baby is breastfeeding, there should be no gap between the chin and the breast. So between the chin of the baby and the breast, there should be no gap. If there is a gap, that means the baby is only sucking the nipple. And when the baby is breastfeeding, the cheeks should blow out when the baby is sucking. Blowing out means a good attachment. After a few sucks, the baby should stop and swallow the milk. If the baby continues to suck, keep on sucking, that means the baby has not properly attached to the breast. I will give you some picture demonstrations in the future slides, so you will understand what we are really talking in this under this attachment. Positioning means how the baby is held by the mother and how the mother keeps her body. This is also very important in breastfeeding. Mother should be comfortably sitting with straight back and with back and feet supported, because if the mother is not comfortable, the mother will not be in a relaxed position. So if the mother's body is not relaxed, she can't produce enough breast milk. The mother should hold the baby with one hand and the breast with the other, because sometimes we see mother holding baby with both hands, and the breast will be not supported. If the breast or baby both are not supported, then breastfeeding cannot happen properly. There should be a good eye contact between the mother and baby during breastfeeding, and baby's head and body should be nicely aligned. So this photograph demonstrates proper attachment of a baby. You can see that areola and nipple are both inside this baby's mouth. There is no gap between the breast and the chin of the baby, and when the baby is keeping the mouth in a O-shaped position, fully open, and when the baby is sucking, the cheeks are blowing out. So this is a baby with a good attachment, and this picture demonstrates good positioning. Now look at the mother. She is very comfortable, back is supported, so there is no pain or stress on the mother which can affect breastfeeding. She is holding the baby properly, and the baby's head and body is nicely aligned. Okay, the baby's head and body is nicely aligned, and mother and baby has good eye contact. If attachment or positioning doesn't occur properly, it will result in inadequate breastfeeding or breastfeeding failure. And breastfeeding failure is mainly due to poor technique, but it can also be due to stress, anxiety, fear, and pain, and also not last but not least is lack of support or wrong advice. When a mother is breastfeeding, she should require a lot of support, especially from her husband, her mother-in-law, sisters, because fear and anxiety and stress all can lead to inadequate lactation. How does a mother know whether the breastfeeding is occurring correctly? Oh, a lot of mothers will have a question, is my child getting enough milk? So there are few assessments which we can do. One is that if a child is passing urine around 6 times per day, then we can say, okay, the baby is getting adequate milk. But remember, during the first 2 to 3 days, the baby might only pass urine 2 to 3 times. So 6 times per day is usually after the first 2 to 3 days of life. Stool color, if it changes from black to yellow by day 4 or day 5, then yes, that is another indication that breastfeeding is occurring correctly. If a baby gets enough milk, he should sleep at least 2 to 3 hours after feed. If the baby is waking up soon after feed, the baby might not be getting enough milk. After a feed, the mother feels that her breast empty and she should feel relaxed. And this should not happen always, but usually when a baby is feeding well, there will be milk dripping from the other breast where the baby is not feeding. So we call that contralateral milk drop, but this is not a must. Some mothers will have enough milk, but when they are feeding, only the milk comes from the breast where the baby is suckling. The other breast will not have a drip. What are the advantages of breastfeeding? So advantages we divide as advantages to the baby and advantages to the mother. First we will go through the advantages to the baby. Now, nutrition in optimum condition is provided via breastfeeding, and it is convenient and ready to drink and comes in a very clean container. Immunological and antimicrobial protection is given because breastfeeding babies, when compared to formula-fed babies, have low ear, respiratory and GIT infections, and they have a reduced rate of allergy. Breast milk not only contains energy, but it contains hormones and growth factors, which are ideal for a growing baby. It not only gives milk or energy, but it also gives digestive enzymes. So it's a very nice food product. It contains the food and the digestive enzymes so that it will be very easy for the baby to drink and digest the milk. And it facilitates mother-infant bonding. Fat in breast milk is more digestible than those in formula feeds. So the baby can easily digest the breast milk fat compared to the fat in formula feeds. The immunoprotective components of human milk includes there are certain chemicals which acts as immunoprotective components. So one is lactoferrin. And lactoferrin, how does it help the child? It binds to iron. Therefore, it renders it unavailable to viruses and bacteria because viruses and bacteria loves iron. To grow, they need iron. But because lactoferrin binds to the iron will not be available to viruses and bacteria in the child's gut to grow. Then lysozymes and milk leukocytes, they will act as destroying agents and they will destroy viruses and bacteria. The breast milk has secretory IgA or immunoglobulins that again help in destroying viruses and bacteria. Then the Bifidus factor, which promotes the growth of beneficial bacteria like Lactobacillus bifidus. And when the beneficial bacteria grow, they limit the growth of disease-causing bacteria or pathogenic bacteria. So these 4 products in breast milk acts as immunoprotective agents in human milk. Another advantage is babies who are breastfed have a low risk of developing obesity, hypertension, dental caries and allergies in future. And they have fairly higher IQ compared to formula fed babies. So there are so many advantages for a baby if the baby receives exclusive breastfeeding. Then what are the advantages to the mother? Well, when the baby is sucking, it causes the mother's uterus to contract and reduce the flow of the blood after delivery. Therefore, postpartum hemorrhage is much less in breastfeeding mothers compared to mothers who do not breastfeed their child. During lactation, menstruation ceases or stops. Therefore, it's a form of natural contraception. Mothers who breastfeed tend to lose weight and achieve their pre-pregnancy figure more easily. Now, every woman likes to have a pre-pregnancy figure after delivering their baby. So, a lot of them will start going to Zumba classes. But if you properly breastfeed a baby, that will be much more better than Zumba. And mothers who breastfeed are less likely to develop breast cancer later in life. A little bit about losing weight. Now, a lot of mothers who are breastfeeding, you will see that they are not losing weight, and a lot of mothers will blame it on breastfeeding. Well, the answer is, a lot of time what happens in Sri Lanka or in countries like Asian countries, people overfeed during breastfeeding time. They think that you should overfeed if you are a mother who is breastfeeding. Well, that's the myth which causes obesity in mothers who are breastfeeding. Just because you are feeding a baby, you don't need to overfeed. You just have to take a balanced, normal diet. That will be more than enough to feed a baby. If a mother takes a well-balanced, nutritious diet, but do not overfeed, then breastfeeding, after a period of breastfeeding, the mother will nicely lose weight and achieve the pre-pregnancy state. So, reason why Asian women get obese during the time of breastfeeding is not due to breastfeeding, because they overfeed during breastfeeding. What are the other advantages? Well, breastfeeding is more economical than formula feeding. You don't have to pay anything to breastfeed, but you have to pay a lot of money to buy formula. There are less trips to the doctor and less money spent on medication if you are breastfeeding a baby. Breastfeeding promotes again mother-baby bonding, and hormones released during breastfeeding creates a feeling of warmth and calmness in the mother. So breastfeeding mothers are more calmer and more satisfied compared to formula feeding mothers. What are the disadvantages? Well, there are very few disadvantages in breastfeeding. One disadvantage is that the breast milk contains low iron and low vitamin K levels, but this disadvantage can be easily overcome by giving supplementation. We inject vitamin K at birth, and we can give iron at any time as iron drops. Pain, stress and infection can reduce breastfeeding. That's a disadvantage. But again, this can be overcome by good support to the mother. Breastfeeding can affect the lifestyle, especially sleep and work. But again, if you modify your lifestyle and with support, again this can be overcome. There are few contraindications in some conditions to breastfeeding. One is active pulmonary TB. If the mother is having active pulmonary TB, breastfeeding is contraindicated. In developed countries, if a mother has HIV, breastfeeding is contraindicated. But in developing countries, because breastfeeding offers so many advantages compared to the theoretical risk of HIV transmission, in developing countries, it's only a relative contraindication. That means if the clinician thinks that the baby will benefit more from breastfeeding rather than stopping it, a mother with HIV still can breastfeed the baby. If a mother has a severe systemic illness which requires strict intensive care uh, for the mother, then again breastfeeding is contraindicated. Okay, then we'll go to infant formula. So infant formula, we usually do not recommend infant formula to babies, but in few occasions as medical practitioners we will have to get the help of infant formula. So we'll learn a little bit about infant formula. All formula are inferior to breast milk. None of the formula are superior or even equal. They are all inferior to breast milk. So you need to know this fact before we go to the topic of formula feeding. Right, so formula feeds sometimes can be useful in premature babies. There are special premature formulas for those babies. And in conditions contraindicating breastfeeds, again, yes, formula feeds can be useful. If a mother has died, then obviously there is no other option but to go for a formula. But in other countries, in some countries, there are banked human milk. That means some mothers will donate their breast milk to milk banks, and if a mother dies of a child, the practitioner can get the milk from these milk banks and give to this child. If a child has been adopted, yes, again the child will have to be on formula feeds, and sometimes during social restrictions, like say if the mother is a single working mother who is divorced, who does not have any other support, she might have to not completely stop breastfeeding but to get some help by adding formula feeds. Okay. Right. So why does formula feeds become popular? Well, anyone can feed formula. Even a cat can feed formula, because all you need to do is put milk powder, add water, mix it well, and using a bottle give it to the baby. So it's very easy to feed compared to breastfeeding. Now breastfeeding you need to learn the proper technique, attachment and positioning, but formula feeds are very easy to give. So that is one reason why it has become popular among mothers. Another reason is due to advertisement, because there are milk companies spend a lot of money to prepare very eye-catching advertisement so that mothers will move from breastfeeding towards formula feeds. Now look at this advertisement, this advert about formula milk. Now look at these words. We have learned from the breast. So this company tries to say that they have learned from the breast, or they are saying that their formula is almost as equal as breast milk. And they have used words such as organic, because a lot of women love organic foods. So our organic baby milk range. So when a mother look at this type of wording, they will automatically believe, or they will tend to believe that this is a product which is almost equal to their breast milk. But we know that whether they have learned from the breast or whether this is organic, all these milk products are inferior to breast milk. Then another reason why formula feeds are very common among, or familiar or popular among the communities, because they are easily available. If you go to supermarket, there will be a whole row of formula feeds available, so anyone can quickly go. If you have money, it's a product which is easily available. So these are few facts, but whatever is done, children always love breast milk. Okay, right, we'll go to another topic. What are the special situations where infant feeding differ from the normal feeding technique. So we'll take a working mother. Working mothers can breastfeed or provide the express breast milk to maintain nutrition for the baby. So sometimes mother will not have the luxury of having 6 months of leave. They will have to go to work, say by about 4 months. That doesn't mean exclusive breastfeeding has to stop just because the mother is working. A mother can express the milk and keep it at home while she is at work. So someone else can give this express breast milk. Express milk can be kept for 6 hours in room temperature or 24 hours if you are keeping it in a refrigerator. And working mothers are entitled to 1 hour of leave each day during the first 6 months of breastfeeding. We call this the milk hour or kiripaya, but now recently the government of Sri Lanka has approved 2 hours of leave for breastfeeding, which the mother can have the luxury of having during the first 6 months. So 2 hours of leave for breast. So they can either come 2 hours late to work or go home 2 hours early, or they can come 1 hour late and leave the workplace 1 hour earlier. So whatever, 2 hours per day. Premature baby, that's another special situation. In premature baby, although the baby is premature, still we try to introduce breast milk as early as possible to any preterm. But there will be problems because the baby will be so small, it will be difficult to feed from the mother. And babies will have a very poor suck reflex if they are born below 34 weeks. Even if the baby can suck, the suck swallow coordination will not be there. The baby will have a very poor muscle function, therefore they will exhaust easily while breastfeeding. And a lot of premature babies have other systemic illness like respiratory distress and infection, which will interfere with breastfeeding. So tube feeding is the best way to introduce breast milk for a premature baby, and either expressed from the mother or from a bank milk in other countries, but not in Sri Lanka. And this breast milk, which is expressed from a mother, is given through a tube to the gut. We call this gavage feeding. Gavage feeding means we put a tube, give the milk and take the tube out. The tube can be introduced in 2 passages, the nasogastric tube or the orogastric tube. Nasogastric tube, we use the nasal opening to introduce the tube. Orogastric tube, we use the mouth. Then supplementation during infancy. What do you mean by supplementation? Supplementation means adding a food product to improve the nutrition value of their natural foods. So babies with good birth weight do not need supplementation at birth. Babies with good birth weight, that means any birth weight above 2.5 kilograms, do not need supplementation at birth. Fortified foods during the second 6 months are adequate to supply minerals and vitamins. But babies who are having IUGR, intrauterine growth restriction, or born prematurely will need vitamin and mineral supplements due to low stores at birth, because IUGR babies and premature babies will have very low stores of iron and multivitamins especially. And during the during the catch-up growth, those babies, IUGR babies and premature babies, will sometimes have a catch-up growth. They will try to catch up their normal peers. The demand for these minerals and vitamins will be very high. Therefore, these babies will need supplementation. And what are the supplements we give? Well, we give iron supplements and multivitamin and folic supplements for IUGR babies. So babies with low birth weight. For premature babies, we give iron, multivitamin, folate, and sometimes phosphate and calcium supplements as well. Iron supplements are usually introduced after first 2 weeks because during the first 2 weeks we do not give iron because at birth the babies are born with a very high hemoglobin load. They will be born with hemoglobin such as 18 grams or 19, 20 like that. So during the first week there is a hemolysis occurring in almost all newborns, and during this hemolysis iron is released. So during the first 2 weeks this iron released from hemolysis is enough. Therefore, we avoid the first 2 weeks before starting iron supplementation. Iron is given as a single daily dose, 2 mg per kg of elemental iron, and continued up to at least 1 year of age. Multivitamin, on the other hand, again can be introduced after 2 weeks, but it should be continued at least until the baby is 6 months old. You can continue beyond 6 months, but if the complementary feeding has been started successfully, and if the baby is getting adequate complementary feeds, those food products will contain enough multivitamins, so you can stop multivitamin supplementation at 6 months. Multivitamins are given daily. Folic acid is given as every other day drug. Normal dose is 1 mg per day. Phosphate and calcium is given only for premature babies with osteopenia of prematurity. Osteopenia of prematurity is mainly a phosphate problem rather than a calcium problem, because in premature babies phosphate will be lost via urine due to immature kidneys, and the blood results or investigations we do to detect osteopenia of prematurity is calcium, phosphorus and alkaline phosphatase level. Normally calcium will be in the normal range, but the phosphate will be very low with elevated alkaline phosphatase level. So we give phosphate supplements plus or minus calcium until the alkaline phosphatase come down to normal range and phosphatase levels normalize. So those are the 3 supplements which we commonly use in either IUGR babies or babies who are born prematurely. So with this we finish the first part of the lecture, where we have discussed about breastfeeding, the breastfeeding technique, advantages and disadvantages, including contraindications for breastfeeding, and then what are the special situations where feeding will differ, and then infant formula, when and when not to use infant formula, and finally supplementation. So in your next part under infant nutrition and feeding, we will start with complementary feeding. Right, thank you.